Well, hello and welcome again, Facebook Live. I'm Chris Stauffer. We're going to be talking about the flu with a preventionist from Infection Control. Megan Meller is joining us.
Hi, everyone.
Hey, how's it going?
Pretty good. How are
All
you?
right. Well, the flu is here. That's something that we want to talk about, but we want to encourage you to send in your questions about the flu, symptoms, anything that comes to mind. We certainly want to try and do our best to address that.
Oh, absolutely.
And we have Katie Keefe, our social media guru, our expert, is here. She is looking for your questions. She's going to jump in with some of those questions. We're going to start off, though, first of all, Megan, if we can. The flu is already in the area. A lot of people are surprised to hear that because it's only, right in the middle of November here, but the flu is here. Yeah,
the flu is here. We've been hearing about it for a couple weeks now from students in our group who are saying, yeah, we've heard that it's on campus, but a lot of patients go in and they'll get diagnosed with influenza-like illness. So that's a little bit different than confirmed cases. So far, Gundersen has only had 2 confirmed cases. Mm-hmm. But that's really the tip of the iceberg because ultimately it is those influenza-like illness symptoms that kind of give a truer picture of what's going on in our community.
Can you give us some numbers, though, statewide and national, because the flu is out in other parts of Wisconsin and the Midwest as well?
I can give you broad estimates. We know that cases are starting to go up in the southwestern region of the state. So per the state health department, that region, so between Dane County, Prairie du Chien, up to probably just about south of La Crosse, they're starting to show an uptake in cases, but they're still below baseline. Rest of the state, we are having some cases here or there, but everything is still pretty low levels. Now, across the country, other states are starting to show an overall increase in flu cases, but nothing severe at this point. But we are starting to see flu deaths. We've some pediatric. Unfortunately, not a lot of them, but we are seeing hearing about 1 or 2 pediatric flu-related deaths and some elderly. Mm-hmm.
So elderly and pediatric population should be getting their flu shots and
the maternal population. So any pregnant woman should be getting their flu shot. Definitely talk with your provider. That's what we always recommend. But that flu shot during pregnancy goes a long way to protecting infants because infants can't be vaccinated until they're 6 months old. Yeah. So those maternal antibodies that the mother generates can pass through the womb and protect the child, and also can be passed through breast milk. So that's why and it offers this really great initial protection during that 6-month time span when the child is vulnerable, especially if they're born right around the start of the flu season when their immune system is just so young at this point.
So get your flu shot. Mm-hmm. Flu clinics are open until November 21st at Gundersen Health System, but there are other ways to get it. You can go to your primary care provider. Now, Megan and I could talk all day long about the flu, but we're encouraging you to send your questions in. Katie Keefe is standing by with some of those questions. Go ahead, Katie.
Yeah, we do have a question. What if people are feeling indifferent about the flu shot? We hear things from word of mouth online. What are the benefits of getting a flu shot?
Benefits of getting the flu shot are, first and foremost, your disease duration is going to be a lot shorter. So people will tend to recover a lot faster when they get the flu shot. Their illness will also be less severe, so they're not going to feel as hard up or bedridden compared to someone who doesn't have their flu shot. Now, there's also these other things, these rare events that we hear about, where you have the 22-year-old who is completely healthy gets the flu, and then 3 days later they're dead, and unfortunately, that organ, that giant overall sepsis and multi-organ failure is a rare side effect of the flu. And the majority of those people that have had that happen to, they're not vaccinated. And that's what you kind of see in some of the pediatric deaths too, is they're not vaccinated. So vaccination also helps protect against some of these more rare occurrences. Now, flu shots also protect those around your loved ones. So if you have a child who is sick and can't be vaccinated, just by vaccinating yourself, so you could offer that protection to them. Same goes, if you have an elderly grandparent or even a coworker who is fighting cancer. They need to be around people who who can protect them, and getting the flu shot is one easy way that you can do your part to protect them.
It's really a community health issue.
Absolutely.
All right. We're talking with preventionist from Infection Control, Meller, about the flu. Some of the things that people will say all the time, how do I know what symptoms are the flu and what is a cold? Can you talk about that real briefly?
So I also want to bring up the stomach flu, because I think a lot of people get confused thinking that the stomach flu is the respiratory flu, and those two are very different. So with the stomach flu, that's going to be caused by noroviruses, enteroviruses. There's other common viruses that circulate at the same time this year as the flu that can cause predominantly those digestive upsets. That said, the flu can cause some vomiting and diarrhea in the pediatric population, but that is still pretty rare. But ultimately, if we're going to compare the flu versus the cold, the flu symptoms are going to appear very abruptly, very rapidly, whereas a cold symptom, they're going to appear gradual. One day you're just feeling a little off, and then by the next day you're like, okay, yeah, this is a cold. The flu, once it hits, you're out for the count. Another thing is fever. Fevers are pretty rare occurrence when you have a cold.
Okay.
But they're going to be a lot more common when you have the flu, as is headache. So cold, you're going to just feel more of that congested, stuffy nose, cough and cold. With the flu, it's going to be the fever, the headache, the chills, the overall body aches. That's really going to differentiate the two.
And can put you out for 10 days at a time.
Yeah.
Yeah. Okay. Katie, more questions?
We do have a question. Some people say they get the flu shot, but then they feel sick after, or they contract the flu. How would you answer that?
So this is one of my favorite myths to debunk, because Chris, you and I had this conversation earlier, and I feel like my father has even asked me this too initially, starting out. And if you're feeling a mild illness, you feel off the day or two after a flu shot, that's really your body's immune system developing an appropriate response. Mm-hmm. It has to learn each year, and so that's really what the purpose of a vaccine is. It's to inject you with parts of the bacteria, parts of the virus, so your immune system can recognize it and then respond fast, because it does take about a week to 2 weeks for your body to develop an immune response against something. And so that's where having that education, if you have that education from a vaccine, by the time you actually get exposed to the flu later on, your body's response can happen in a matter, of mere days rather than weeks. Now, if you get the shot and then 3 days later, it's just you're just out for the count again. You have the flu. You did not get it from the shot. The shots are designed to not to make it make you unable to actually get the flu from the shots. Shots are pieces of the virus, with the exception.
It's not the virus.
It's not
pieces.
the virus, with the exception of the flu mist, which is a little bit of a different makeup. But for those, I would recommend talking to your provider before getting that, because they can explain the risks. But for the general populations who is receiving your generic flu shot, it's just pieces of it, and those can't come together to give you the flu.
You mentioned the flu mist. That's available this year. I don't believe it was last year, if I'm correct.
No, it wasn't available last year because it was having some efficacy problems with its H1N1 strain, which is one of the circulating strains. And so they took it off the market so that way they could redevelop it a little bit better. And so they've done some of the initial clinical trials, and it is now out in the market and safe to use for everybody.
All right. Katie, more questions?
Yeah. Is it better to get a flu shot at Gunderson or any of the health clinics? Or what's the difference between getting a flu shot at Walgreens or Gunderson Clinic? Is it the same?
It is the same shot all around. So it's not I feel like the pharmaceutical market, you have one vaccine and it gets distributed to everybody. Now, some clinics can choose not to carry certain ones, like Flu Block, which is kind of a newer strain out on the market that's a cell-based vaccine. That's not going to be available everywhere, and that's just kind of dependent on which organizations or companies have decided to carry it. Gunderson is carrying it this year. But your typical flu shot, it's not going to vary from one location to the other, so there is no one better place to get it. So no matter where you're going to go, you're going to get the same vaccine.
Now, we mentioned that the flu shot clinics at Gunderson are open till the 21st. However, you're recommending that even after the 21st, talk to your primary care provider, talk to somebody about where to go for a flu shot.
It's never too late. I've heard of people waiting until December, which, at that point, you're getting into the middle of flu season, and it's still not too late. It's never too late in January. Whenever you get the flu, we always encourage people to get their flu shot sooner rather than later. especially when you start seeing cases and you start hearing about deaths. But I'm trying to get back in my train of thought.
It's okay.
But no, we always recommend, so once the flu shot is closed, talk to your healthcare provider, because they will, without hesitating, will give you the flu shot. Many pharmacies will continue to carry the flu shot until throughout the rest of the flu season. Gunderson even has our D and Bergen pharmacies will continue to carry and give away flu shots for the rest of the season.
Okay, still time to get that flu shot, Katie.
And no appointment needed.
No appointment needed.
Yes, no appointment needed.
I feel like that walk-in aspect of the flu shot clinic is just a huge boon for a lot of people, because especially if they're during working hours, it's just hard to make that time or schedule an appointment with your provider. But when you have this ability to walk in, whether it's in the morning or to come in late after work, it's really beneficial. And that's something that our flu shot clinic recognized, and they changed their Friday hours around just to help accommodate more people.
I think I was in and out under 5 minutes. So it just takes 5 minutes of your time, and they're ready to go with all your information, and then you're in and out. So
even if you're going to the doctor for something else, like a sprained ankle or something, you can be like, hey, while I'm here, can you give me the flu shot? I've heard that happening too, and that's so you don't have to be go in just to get your flu shot. If you're there for another reason, definitely ask about getting the flu shot then.
And we were talking earlier about the numbers, only a few cases in the area maybe right now, but with the holiday season coming upon, this is when it really starts to seem to take hold and take. What advice for folks that are out there that may be gathering and maybe not be feeling so well when it comes to those holiday gatherings and get-togethers? I
always want to say use your best judgment, because I can recognize, wanting to see loved ones that you haven't seen in a while, or, your cousins from, the other side of the country who are coming in with their young child and you want to meet them, and then you get sick. You also have to take care of yourself too. If someone is just, they just have it bad, they have a fever, they're constantly blowing their nose, they can't wash their hands, just stay home. Take care of yourself. Your family will understand. Maybe it's that day or two is all you need just to rest, and then you can see them. And then you can spend that time with them. If you're on the rebound, then I've had aunts and uncles who are like, no, I want to be around you, but I'm not going to hug you because I'm just getting over this cold, and that's perfectly acceptable too. So we always practice just good, I say, cold etiquette. Cover your cough. Good hygiene. Cover your cough. Don't sneeze into your hands. Try this. I would say dab. Sneeze into your shoulders. And wash your hands. Just carry that alcohol gel with you. Those little those little bottles that you can get practically everywhere.
And I think more and more people are almost get upset when somebody comes in where they have a severe, whether it's a cold or maybe even a stomach virus. People get upset when you come in. They'd rather have you join them via FaceTime or something along those lines.
FaceTime is great for that too. If you're like, okay, I can't be here, but at least I can see your face and enjoy that.
Katie, more questions?
So when you contract the flu, how long does the flu live in your system usually?
I'd say, so that's a hard one. It usually takes, I heard the incubation for the flu is about a day and a half to 3 days. Okay. So people can be infectious a day before they start showing symptoms, which is kind of like an evolutionary thing that the flu has developed, which is, very interesting. But usually once the fever breaks, people don't tend to be contagious anymore. So it's with the flu, or their contagious goes down. So even here at Gunderson, we say please don't come back into work until you've been free of a fever for 24 hours. I think it's either between 24 and 48 hours.
Does that count for children as well? So if parents want to send their kids to school, is that the same?
We recommend that for children as well. Giving their bodies time just to recover, because also when you go with school-age children, there's a lot of other stuff that's floating around that school. And one of the side effects of the flu is pneumonia, so bacterial or viral pneumonia. So if your immune system has already kind of fought the fight against the flu, it's just kind of on the rebound. If you expose it to something else, your body might not be strong enough that second time around to fight something off as effectively. Yeah. And so with some of these cases of hospitalizations, that's really what's happening is these people, they got exposed to something else shortly after, and now they have to be hospitalized because they're they just can't breathe as well. They have pneumonia.
I hear time and time again people say,
Yeah.
well, I had the flu last year and it lasted, 2 or 3 days. That's not the type of flu that we're talking about, though.
No. And like, so what do you mean? Develop it.
Well, typically the flu is much more severe than a couple of days. The flu can last 10 days and can require hospitalization and is really a whole different thing that we're talking about. That's what we're talking about with it being immunized for.
Right. Well, and even if you're like immunized, like I had a friend who was immunized and she got the flu, which can still happen because flu strains are a little bit different and they can change throughout. So you can, so get the flu while getting the flu shot. It's just your symptoms are going to be less. And so she was sick for like a day and a half, and then she started feeling better, which is a lot different. So people can still have that like really short, rapid duration, and then kind of start improving.
Especially if they get that flu shot.
Especially
right?
if they get the flu shot.
Is there any research being done? Now I know the flu happens. There's flu season every year, but what's the latest research that you know of that's being done about the flu?
I know one of the biggest like motivations with the flu is related to the flu shot, trying to make it just like a one shot, kind of deal for the rest of your life.
Oh,
and
wow.
there's studies coming out, but everything is very preliminary. And what I like to remind people is there's a really big process for like developing a vaccine in general. The number of trials it has to go through and the different organizations that have to approve it. So it's absolutely encouraging that scientists are finally making some leeway with trying to figure out what's our like one shot deal. So I'd hope that maybe in like 5 to 10 years we'll finally have something on the market, but it's still years away.
Yeah. All right.
I know another thing that scientists are kind of with research watching out for is the fact that we are due for our next pandemic. It's 2018 is the 100th anniversary of the 1918 Spanish flu, which for historians and micro nerds like myself is, it's very interesting and it's very humbling too, just because of how like traumatic and how widespread the 1918 flu was, like how many people it touched and how it affected so many lives.
Wow.
And
you're saying we're overdue.
And and the thing is, like, we're overdue. We're overdue for something like that. And the best tools that we have in our arsenal to protect ourselves and our loved ones and our friends and family against all of this is getting our flu shots. It's staying up to date on our vaccines. It's washing our hands. It's good cold etiquette. It's all of these little things that can really make a big difference. In the end.
That doesn't influence you to get your flu shot. I don't know what does.
Yeah. So get your flu shot.
Yeah,
please get your flu shot.
Yeah. We're going to be winding things down here, but we do want to encourage you to send your questions in. Megan's going to stick around a little bit, and she'll be continuing to answer those questions. Katie, I'm not sure if there's another question that you wanted to fire away here.
I'm good. I just want to make sure that you guys know that the flu shot clinics are located at the Gunderson La Crosse campus, level 3 of the main clinic, and in the lower level clinic of the Gunderson Onalaska Clinic. Both sites will be open Monday through Friday from 8:30 a.m. to 6 p.m. and from Fridays from 8:30 to 4:30 p.m. through November 21st. So no appointments are needed. I just want to stress that as well.
And another thing I want to stress too is like, when should you see a doctor? Because if if you've been vaccinated, you're a healthy individual, and your flu symptoms last for about 3 to 4 days, and you're feeling better, you don't need to go see a doctor. Many people can fight that off without seeking medical attention. But if your symptoms get better and then all of a sudden they get worse with like a vengeance, please seek like medical attention immediately. If you're experiencing any like pain or pressure in your chest or abdomen, you're dizzy, there's confusion, you can't keep anything down. Or if your child, their skin's kind of turning bluish, like they're having some sort of respiratory problem, shortness of breath, or they're getting dehydrated, please seek medical attention immediately. That's when you really do not want to mess around.
All right. Good advice. Early in the flu season.
Early in the flu season, please remember that.
All right. Megan Meller, a preventionist with infection control at Gunderson Health System. Again, we encourage you to send your questions in here to Facebook, and we'll do our best to get those answers out to you. But in the meantime, thanks for joining us. I'm Chris Stauffer, and have yourself a great afternoon.